Welcome. Today we will learn about Ansaid medicine. Ansaid Flurbiprofen, LCI, are 30 tablets of 100 mg. The tablets belong to the pharmacotherapeutic group of medicine. It is an anti-inflammatory and anti-rheumatic product, non-steroidal, propionic acid derivatives. Flurbiprofen has analgesic, anti-inflammatory and antipyretic properties. These are thought to result from the drug's ability to inhibit prostaglandin synthesis. Caution: to be sold on the prescription of a registered medical practitioner only. Package contains. Each package contains 30 Ansaid tablets of 100 mg and in enclosed informational leaflet. Composition: each tablet contains Flurbiprofen USP 100 mg. BP. Specifications: free of gluten. The product contains lactose. Excipients: lactose EPNF monohydrate. Spray dried, colloidal silicon dioxide, microcrystalline cellulose pH 102, cross-carmelose sodium, NF, magnesium stearate, OP/YS 14254 blue and carnauba wax. Dosage: use as prescribed by the physician. For further information, please read the enclosed leaflet. Therapeutic indications. Uses: Ansaid tablets are used for the treatment of rheumatoid disease, osteoarthritis, ankylosing spondylitis, musculoskeletal disorders and trauma such as periarthritis, frozen shoulder, bursitis, tendinitis, tenosynovitis, low back pain, sprains and strains. Flurbiprofen is also indicated for its analgesic effect in the relief of mild to moderate pain in conditions such as dental pain, post-operative pain, dysmenorrhea, and migraine. Dosage and administration. For oral administration, to be taken preferably with or after food. Undesirable effects may be minimized by using the lowest effective dose for the shortest duration necessary to control symptoms. Adults, 150 to 200 mg daily in 2, 3 or 4 divided doses. In patients with severe symptoms or disease of recent origin, the dose is increased to 300 mg in divided doses. For dysmenorrhea, the maximum total daily dosage should not exceed 300 mg. Pediatric population. Flurbiprofen tablets are not recommended for use in children under 12 years. Older people. The elderly are at increased risk of the serious consequences of adverse reactions. Although flurbiprofen is generally well tolerated in the elderly, Ansaid should be used with caution, and dosage should be assessed individually. If an NSAID is considered necessary, the lowest effective dose should be used for the shortest possible duration. The patient should be monitored regularly for GI bleeding during NSAID therapy. Contraindications. Flurbiprofen is contraindicated in patients with hypersensitivity to flurbiprofen or to any of the inactive ingredients. In patients who have previously shown hypersensitivity reactions in response to flurbiprofen, aspirin or other NSAIDs. It should not be used in patients with active, or a history of, ulcerative colitis, Crohn's disease, recurrent peptic ulceration or gastrointestinal hemorrhage, with severe heart failure, hepatic failure and renal failure. During the last trimester of pregnancy. Special warnings and precautions. On prolonged use of any painkiller, headache may occur that must not be treated with increased doses of the medicinal product. The tablets contain lactose. Patients with galactose intolerance should not take this medicine. The use of flurbiprofen with concomitant NSAIDs, including cyclooxygenase 2 selective inhibitors, should be avoided due to the potential for additive effects. Caution should be advised in patients receiving concomitant medications, which could increase the risk of ulceration or bleeding, such as oral corticosteroids and aspirin. Interactions. Care should be taken in patients treated with any of the following drugs, as interactions have been reported in some patients: diuretics, ACE inhibitors, and angiotensin II antagonists, lithium salts, methotrexate, anticoagulants, antiplatelet agents, aspirin and cardiac glycosides, cyclosporin, corticosteroids, selective serotonin reuptake inhibitors, SSRIs, other analgesics and cyclooxygenase 2 selective inhibitors, mifepristone, quinolone antibiotics and zidovudine. Therefore, the combination should be administered with caution, especially in the elderly. Fertility, pregnancy and lactation. The use of flurbiprofen may impair female fertility and is not recommended in women attempting to conceive. In women who have difficulties conceiving or who are undergoing investigation of infertility, withdrawal of flurbiprofen should be considered. During the first and second trimesters of pregnancy, flurbiprofen should not be given unless clearly necessary. During the third trimester of pregnancy, all prostaglandin synthesis inhibitors may expose the fetus to cardiopulmonary toxicity, renal dysfunction, possible prolongation of bleeding time, and an anti-aggregating effect which may occur even at very low doses. Consequently, flurbiprofen is contraindicated during the third trimester of pregnancy. The onset of labor may be delayed and the duration increased with a greater bleeding tendency in both mother and child. It is excreted into human breast milk. However, the amount secreted is only a small fraction of the maternal dose. Flurbiprofen is not recommended for use in nursing mothers. Effects on ability to drive and use machines. Undesirable effects such as dizziness, drowsiness, fatigue and visual disturbances are possible after taking NSAIDs. If affected, patients should not drive or operate machinery. Undesirable effects. Ansaid undesirable effects or side effects are the following: gastrointestinal disorders. The most commonly observed adverse events are gastrointestinal in nature. Peptic ulcers, perforation or GI bleeding, sometimes fatal, particularly in the elderly, may occur. Nausea, vomiting, diarrhea, dyspepsia, flatulence, constipation, abdominal pain, melena, hematemesis, ulcerative stomatitis, exacerbation of colitis, and Crohn's disease have been reported following flurbiprofen administration. Less frequently, gastritis has been observed. Pancreatitis has been reported very rarely. Immune system disorders. Hypersensitivity reactions have been reported following treatment with flurbiprofen. These may consist of non-specific allergic reactions and anaphylaxis, respiratory tract reactivity comprising asthma, bronchospasm or dyspnoea, or assorted skin disorders, including rashes of various types, infections and infestations, exacerbation of skin infection-related inflammations, e.g., development of necrotizing fasciitis, coinciding with the use of NSAIDs has been described. If signs of an infection occur or get worse during use of flurbiprofen, the patient is therefore recommended to go to a doctor without delay. Cardiovascular disorders and cerebrovascular disorders, edema, hypertension and cardiac failure have been reported in association with NSAID treatment. Clinical trial and epidemiological data suggest that use of some NSAIDs, particularly at high doses and in long-term treatment, may be associated with AS autoimmune disorders, such as systemic lupus erythematosus and mixed connective tissue disease, with symptoms of stiff neck, headache, nausea, vomiting, fever and disorientation. Instructions: avoid exposure to heat and sunlight. Store below 30 degrees Celsius. Keep out of reach of the children. Consult the doctor or physician for proper dosage level and duration. Manufacturer and buy online. Ansaid tablets are manufactured by Lucky Core Industries Limited. It is available online or can be purchased from any nearby pharmacy. A full box of Ansaid 30 tablets is priced at approximately 382 rupees, while a strip of 10 tablets costs around 133 rupees. Thanks for watching and supporting. Take your medicines as your doctor or pharmacist prescribes them. You can check its article at MedsArchive.com. Have you ever used this medication? Please share your experience in the comments. Which medicine should we cover next? Your suggestion could be our next video. MedsArchive 1.